Cardiac arrest is a common, sudden and serious condition in which the heartbeat and breathing stop. The transport of oxygen to the brain stops, and this leads most commonly to death. More than 9 out of 10 people die after a cardiac arrest. Once chest compressions have begun and electric shock applied to the heart if necessary, a paramedic treating a patient in cardiac arrest must keep their airway clear. There are 2 main methods. The traditional method, intubation, where a tube is passed from outside to this point here, or a newer method, supraglottic airway or SGA, in which a new type of device does not sit as deep and is placed just here. The traditional method, intubation, can be more difficult to achieve, needs 2 paramedics and can take longer. The SGA method is quicker and easier, but it is not as secure, and if a patient vomits, that vomit can go into the lungs. Finding out what works best in practice can save a lot of lives, because just a small improvement in survival for such a common and catastrophic event adds up to lots of real people going back to real homes. The only way to know what works best is to do a randomized controlled trial. These trials are the gold standard for comparing 2 clinical treatments for the same problem. Thankfully, the NHS supports this kind of research. Over 1,500 paramedics were involved over 2 years, and more than 9,000 patients were included to directly compare the 2 methods. Each paramedic was asked to use one method over the other as standard, unless circumstances demanded otherwise. Initial ventilation success using the SJ method saw an 8.4% improvement, with no significant difference in how often vomit got into a patient's lungs. But that didn't lead to any difference in the number of people who recovered and went home. However, paramedics using the SGA were more likely to stick to this than paramedics using traditional methods. And when comparing those patients who actually received an SGA or intubation during the cardiac arrest, those who received an SGA were more likely to do better and end up going home. International experts and paramedic leaders are currently deciding how the results of this research should change clinical practice for the many thousands of patients who suffer a cardiac arrest every year.